Ma'am, you can start.
Good evening, members of Association of International Educators. Good evening to all the frontline warriors who have been serving our nation and the world with all the dedication, devotion, courage, and lot of faith. I also want to thank all the doctors, the people who are religiously working towards the various good cause for the human kind. And today, on the similar note, we have a guest amongst us, a very young, enthusiastic doctor, Dr. Kunal Shah. Dr. Kunal Shah, I welcome you on the group of Association of International Educators. And we have been following this story of the Frontline Warriors series. And today is the 5th episode of the same. Good evening, Doctor, and welcome.
Good evening, Amita, and good evening to everyone. And many thanks to all the members of the Association of International Educators Group for inviting me on this forum for sharing my knowledge and experience regarding it. Thank you very much.
Thank you, Doctor. Thank you. And it was kind of you to accept the invitation. And I would also like to inform our viewers and our members that last week we were unable to have the story of the Frontline Warriors series guest, as all the doctors and the NGOs and other associates are busy. The Frontline Warriors are so busy with taking care of the COVID situation and looking at the vaccination drive, looking at various other things. So let's start from this, Doctor, today's conversation. I think the word that comes to my mind is vaccination drive. So there are so many apprehensions, when I look at the news that people are running into the rivers and hiding in the rivers or hiding into the jungles and not taking the vaccination. And on the other side, in a city like Mumbai, where people want to take vaccination because they want to travel abroad, they want to go for overseas study. तो इतनी सारी जो ये वैक्सीन को लेके मिथ्स और कंफ्यूजन और ये सारी चीज चल रही है, what is your view on the same?
See, my view is very simple. If we want to come out of this pandemic, vaccination is a must. Vaccination will get us out of this current scenario where we are, wherein we are living with a lot of boundaries and a lot of restrictions on moving about, on socializing, on meeting our friends, our families, attending the any religious functions or marriages or anything. If people want to resume that, we have to vaccinate as many people as possible. Okay, even right now also, when you were talking about that there is so much of rush for vaccination, see, mind you, let me bring one thing to your notice, that all the people who are taking vaccine, even after standing in queue for 2 hours, 3 hours, they all are from the upper socio-economic strata. So we still have the lower class which is not willing for vaccination. And that is what you already mentioned, that we listen to all these kind of news in villages and all, that people are running away, they hide in their houses, they jump in river just to avoid vaccination. It is the same thing, that once you are aware that what vaccination can do, if you know the benefits of it, which far outweighs the side effects or the symptoms what it produces, and because of which people are afraid to take vaccine, once they are properly educated, I think so this thing should go away.
So, Doctor, what I understand from your view is there lack of education and lack of understanding why it is important to take a vaccine? Do we lack in providing that information?
See, the educated class, they are well aware of what vaccine can do, and they have seen the benefits themselves during the second wave, right? But it is the lower economic strata which is still unaware, because largely they were not that affected during the second wave, by and large. Okay, So you would have seen the lower socioeconomic people moving around at the peak of in the second wave without mass social gatherings and everything
Absolutely.
over there, and they were just not bothered, so it did not impacted them, so they felt ke unko abhi hoga hi nahi. But this is
Ji.
the same mistake what we did after the first wave. We thought that it will not impact us, and then we started COVID abusive behavior, and then the second wave hit us. So it is very important for us individually also to educate all the people around us. It is my responsibility, is not limited to myself or my family, but it also includes my responsibility towards my driver, towards my mates who are working at my place, towards my home servants, towards my watchman, towards my liftman. So I have to spread this message to all of them that it is, we have to vaccinate each and every person.
Right. So I would like to tell my viewers that Dr. Kunal is a practicing homeopathic physician with a clinical experience of more than 10 years and also catering to all type of diseases including COVID-19. And he is currently here on our request in his busy schedule because I have seen personally, I have been involved and we are also very good friends beyond the patient and the doctor relation, but he dedicatedly works towards his patients, and particularly at this point I think he wants to share a couple of things, the experience, the knowledge of how and what should be done, uh, keeping in mind this whole vaccination and the COVID current scenario, that is the second wave and the onset of the third wave, doctor.
Right. So, see, by and large, all throughout the country, I'm not talking about only Mumbai, but all throughout the country, I think so. We are seeing in the decline in the second wave. Okay, where the cases were say around about 4 to 4.5 lakh per day. From that, we have gone down to 1.5 lakh or so per day. The death rate, which was around about 4,000, 4,500 per day, we have come down to 2,000, 1,500 to 2,000 death rate. So there is no doubt about it that we are going down. Of course, Maharashtra and Mumbai are, they are declining at a faster pace than that of the entire country because we had a second wave in the starting than what the rest of the country had. So it is because of that our second wave phenomena is settling down. But if we do not take correct preventive measures right now, and if we do not follow COVID appropriate behavior, we can definitely and surely will have the third wave. And to avoid that, it is very, very important. See, now all over India, we are planning, the unlock is starting from tomorrow. So it will be very, very important for us to follow all the protocols. Masking is one of them. It is very, very important. Let me share some experience with Paul. That see, I have a lot of doctor friends, okay, and some of them are surgeons as well. And touch wood, in this entire 1.5 years, they have been seeing patients, attending their clinics regularly, operating on them, but they have not been infected with COVID till now, even during the first wave as well as in the second wave. And masking is one of the very important reasons why they could succeed in that. They were always wearing that N95 mask, mind you, properly fitting N95 mask. Okay, the N95 mask, which has holes and which has all the air coming in and out, is not considered as a proper mask for anyone. So masking is that much important. Hand sanitization remains very, very important because the with so many patients around of COVID, you are bound to catch infection uh, anywhere at any place, and that infection you can easily transmit to others. So hand sanitization is very important, and social distancing that can be maintained only if you step out, if it is essential. Otherwise, you are requested to stay at home because stepping out unnecessarily will increase the risk to yourself and to your family. The other notion what people have is that once I have had COVID, there are no chances for me to have a second
Yes,
attack of,
yes, yes,
right? Which is
yes.
absolutely wrong. I have myself seen so many patients who are having a reinfection after a few months. Okay. In fact, if I have to quote few of very senior physicians who have been practicing COVID, they have seen patients who are getting infected for the third time as well. Right. So
Right.
it is very, very important that once COVID, if once a person is diagnosed with COVID, that does not give him or her a liberty of not following COVID appropriate behavior.
Yeah. And also, at this point, if I may ask a very personally related question. So, yesterday, ironically, it was a very sad moment in my life. One of my childhood friend um, could not survive the COVID. And so it made me think a little bit. And what the doctors gave the reason is that it was a multi organ failure. So maybe I thought, as a person, I don't know. And if you could tell us little bit more that how is COVID resulting in multi organ failure, which is resulting in the death of the person. So she got admitted 1 month back with some slight symptoms of COVID. And once she got admitted 15 days back, her heart started, heart rate started going low and ventilator was put in. So, now the family is under the dilemma कि अगर अच्छा होता अगर हम हॉस्पिटलाइज ही नहीं करते शायद बच जाती. आप समझ रहे हैं जो एक वो नॉर्मल लेमैन होता है वो जो फैमिली है शी सर्वाइव्ड विद 2 sons and a husband. So the husband is thinking that maybe it was good that I would have treated her at home rather than putting her in a hospital. I mean, I do agree, and I do want to say that everybody has a DNA amount of the breaths that a person is born with. But all these thoughts keep coming in a person's mind that shayad survive ho jati. So I don't know. As a layman, I thought maybe you could throw a little light. The pain that the family is going through, and that whole एक जो scenario बन गया है, and I mean losing that faith कि अगर मैं हॉस्पिटल नहीं लेके गया होता घर पे ट्रीटमेंट कर ली होती तो शायद बच जाती. तो it means you have lost your faith in the hospital and the doctors, which I don't think is the right approach, because I do not personally, I don't believe it, but again the person who's going through it. So how would you like to take, or what would you like to, in our audience, in our viewers, there would be many people who are going through similar type of mental pressure. What would you like to tell them?
See, first and foremost, the one who is facing the loss, it is tremendous for them. Okay, at that point of
Absolutely.
time, the sense of grief is overpowering any logical decision what a person can make, right?
Absolutely.
The second thing is that if a person could not be survived uh, in a hospital, there is no chance that the person could have make it at home. If any possibility for that person to survive was there, it was in the hospital. So probably she was in the right hands. But this COVID virus in itself behaves very funnily. Okay. We are not sure about almost anything regarding this COVID virus. We all are in the initial stage. We all are learning from this thing every day, each and every single day. And we are uh, adding on to the information what we have collected every day, right? So see, this COVID is known to cause these kind of complications, right? The first and foremost place where usually the if you are talking about the organ damages which are caused by COVID-19, see,
Yeah.
up till now it has been proved that COVID causes a lot of damage. It can cause a lot of damage to your heart, to your lungs, to your liver, to your kidneys, to your brains, to your blood vessels, everywhere. Okay, so and of which the most commonest is the lungs, wherein what does it does is it causes damage to the tiny air sacs, which we call it as alveoli,
Yeah.
which are there in the lungs, where usually the exchange of gases happen between
Yes.
the oxygen and the
And carbon dioxide.
right. So the gases exchange happens at that place. So when it leads to fibrosis, what we medically call as fibrosis, wherein
Yeah.
that tissues are affected with your COVID virus. Then what happens is that exchange does not happen, and this leads to a permanent long-term defect wherein the patient develops a lot of breathlessness. There is need for this oxygen because the alveoli have destroyed and there are very few remaining. So these are the long-term complications of COVID. And then once we have COVID pneumonia, then what happens is that the body, it goes into something what we call it as cytokine storm syndrome, wherein then the body's response to the virus is so overwhelmed that it starts destroying anything and everything which comes in its way, and that's why it causes a lot of damage to all these organs. I would not like to go in detail because that would be very technical for our audience. But these are the things. Also, a very common complications with COVID is that it tends to develop a lot of blood clots. Okay, so as in the blood becomes very thick. So it is very important for a COVID patient that once he recovers from COVID, he has to undergo all his regular investigations to see whether the blood is becoming more and more thick, more and more viscous or not, and then we have to treat it accordingly. So see, it happens. It has happened. Coming back to your question, see, it happens. It has happened to a lot of doctors as well who have been vaccinated for 2 doses, and even after that, unfortunately, they were not able to make it. Okay, so these kind of see, what we call it as those infections they are breakthrough infections, wherein they pass the immune escape. They go through what we call it as immune escape, wherein the virus passes through the immunity which we have built up even after vaccines. So it is highly individualistic at such levels, but overall, by and large, it gives a significant amount of protection to people.
So a vaccine is a must. A person should not go with all these, all these case studies where after the vaccine, a particular case has happened. People should go ahead and take the vaccines.
See, those cases are very
Rare and few.
far and wide. So we cannot give any significance to those cases because on a larger whole, say out of 10 lakh people, if 4 or 5 develops any such complication, see, we have at this point of time we don't have any other option. So we
Right.
have to go through what options are available to us.
Absolutely. Very true. Absolutely. So, doctor, how is homeopathy as a line of medicine? Like you particularly know my case that I cannot take too much of allopathy. And similarly, like me, there could be many other patients who cannot take allopathy and are, subjective to allergic asthma, are subjective to more allergies, right? And at the same time, cannot take too much of allopathy. And when they take this vaccine, is there going to be any particular effect to such patients? If you could advise a little bit.
See, answering your first question, uh, how does homeopathy have a role to play in these kind of COVID cases and other patients as well? So, see, first and foremost, what happens is that even if anybody is having, say, if a person has contracted a COVID virus infection and he or she is showing some signs and symptoms of COVID, first and foremost thing, what happens is there is a lot of mental anxiety. There is a lot of fear. There is a lot of uncertainty. कि क्या होगा, मुझे क्या होगा. See, I have a patient right now whose uncle unfortunately expired 12 days back, and he got infected with COVID immediately after that. He's a young patient, doing well. All his parameters are normal. Day by day, he is improving. All his parameters are monitored directly by me. But still, he's having that fear and anxiety कि मुझे कुछ होगा तो नहीं ना, क्या मैं हॉस्पिटल में एडमिट हो जाऊं, so that I am safe. Are you confident? So this type of anxiety is too much. So we have wonderful medicines for these kind of anxieties. That is number one. Number two, for COVID infection per se, see, one thing is very clear and very good about our state of Maharashtra, especially if I have to say that the task force, the doctors which have been appointed by our honorable chief minister, or those task force has decided clearly on the parameters on which you can treat your patient. So if your patient falls in those criteria, there is no need to panic. You can treat them at home, and you can treat them with any medicines or with any system of medicine, whatever you want, till the time they maintain the saturation level, the fever is under control, they don't have any other complications or anything of that sort. So have we have treated a lot of cases with mild symptoms, people who are asymptomatic but have high risk population at home with lot of comorbidities. So those patients we can treat mild symptomatic, mild to moderate symptoms. All these patients can be very well, very nicely managed at home. Regarding your second question about vaccination in people who are having these hyperactive airway diseases, which includes your bronchitis, your asthma, your recurrent cold and cough, by and large, you will not have any complications after taking in the vaccines, apart from the normal complications which everybody gets, especially after Covishield, of fever, weakness, cold, cough, hand pain, lethargy, and all. So that remains for 2 to 3 days. After that, the person is fit to.
Right. Wonderful. So I think this has cleared a lot of my mind. I think I'm also getting the courage. I have booked myself for the vaccine, but I was having all these, I wouldn't say fears. I was just having all these little clouded thoughts in my mind. So like me, there would be likewise patients, and I know that I can always catch hold of you and call you up. So viewers, again to say, Dr. Kunal Shah, presently operates from Juhu scheme area in Mumbai, Maharashtra, India. So globally, Dr. Shah, globally, almost 100 cities, people from 100 cities are members on our group. So that is the reason I'm just giving them the geographical bifurcation of the area. Also, it brings me to ask that I do remember the day when, in the entire Jew scheme, it was a very sad feeling when Dr. Pankaj Shah, your respected dad, in the first wave. So now let's put that son and the doctor together, and maybe we can hear from you the courage. When, like I said, the children keep feeling, or the husbands or the sons or the parents, they keep feeling, if I could have done this, or if I could have done this. And I remembered the day Dr. Shah got admitted, we all got so, everybody, I think the whole Jew scheme was calling you up, right? Entirely, I think people would have been calling you up, because you and Dr. Pankaj are so renowned and famous in the area. So as a son, as a doctor, how did the emotional, your state, and what advice you would you like to give to other people at that particular moment when you have to handle the elderly patient in the family, and as well as your role as a doctor, and then answering to maybe 100 calls or messages. Yeah.
Right. So, well, actually, that seems like an ages back. It happened
Yes.
almost a little more than a year
Year
back.
back. Yes. Yes.
Yeah. So I see at that point of time, there was a lot of uncertainty,
Yes.
because, as I told you, that at that point of time, we were learning, all of us
Yes.
were learning about what the disease is, how to manage it,
Yeah.
how to follow the protocols, what medicines need to be taken, how to take care of them, and or what to do. Everything was a big question mark. There was nothing fixed. So more than anything else, uh, more than anything else, it was the anxiety about how the disease will progress in them. Since my dad is a senior citizen,
Yes.
so that was the anxiety, that how the disease will progress. Luckily, we could. Luckily, we got a hospital bed very fast. So I got him admitted in the hospital, and then it was just waiting and observing day by day, learning what's
Yes.
happening in him, what's happening in me. Even I was detected positive at that time because I was taking care of him at home. But largely I was asymptomatic. So I never experienced any symptoms. So that was even more curious for me. It was even more कि भाई क्या हो रहा है कुछ नहीं हो रहा है सिर्फ नाम है कोरोना वायरस का बट I'm not having any complaints so what kind of a funny illness is this
Yeah. Yeah.
so uh, that is it but the fear was more at that point of time.
Yeah. Yes. I'm
It
sorry.
was mainly to allay that fear and anxiety and just take it as and when the day comes. I would really suggest even now. See, now we are better prepared. I very well understand that once if there is a COVID infection in any family, there is a lot of panic around because the entire thing gets disrupted. There are all of a sudden there are a lot of roadblocks that what to do, how to go about it, and how to take care of them. I see most of us, we have our parents at home or we have our small kids at home. So the anxiety is mainly for them that they should be safe. So at that point of time, it is very important to calm yourself, to do not get too anxious, do not move too ahead of the time. Just take every day at a time, observe yourself, see whether are you having any symptoms or no. Even the smallest of the symptoms, minute of the symptoms, please report to your doctor. Stay in touch with your doctor uh, through a WhatsApp or through a call every day. I personally advise all my patients to give me a call at least once a day so that I have a track of them, that how are they doing in this COVID infection and whether they are developing any new symptoms or not.
Right. Right.
You just have to be observant enough. Any complications, any red signals, there shouldn't be any chance. One should not take any chance and straight away get themselves checked.
So, but today when we see, I think we are better prepared than we were because like you said, this happened in the last April, almost 14 months back, no? Hana? So,
April and May starting.
yes, April and it was the first wave, and everybody had so much of anxiety, panic, and like you said, curiousness. So today, I think we are very well prepared, at least to take care of our elders and to give them the right guidance and to predict a pattern. Can a pattern be predicted, or
Yes,
we are
absolutely.
okay?
Absolutely. In most of the cases, the patterns can be predicted. And that is the reason why we have been able to cure a lot of people and without any complications. And of course, the infrastructure now is better prepared. We have adequate number of hospital beds, ventilators, oxygen supply, medicine storage. Everything is there. We have protocols which are fixed and which are firm. So we are definitely well prepared. And now though there is definitely no need for anybody to get anxious about it. It is just that there has to be, you should not stay in a state of denial at this point of time. It is very important. If you have any symptoms, if you develop any symptoms regarding COVID, be it it can be as simple as only loss of smell. I have had a patient who had only loss of smell. He was standing and he was preparing tea for himself and he couldn't smell tea. And he called me immediately, doctor, there is something wrong. Why can I not smell tea? I said, please smell coffee and see if you can smell that. He says, I cannot smell it. No other symptoms. We got him tested. This was during the first wave. We got him tested. He was COVID positive. So it can be, symptoms can be as mild as that. Or you can have the normal routine fevers of throat irritation, cough, fever, loss of smell, loss of taste, weakness, tiredness. Any of those symptoms, you have to get yourself tested, report to your doctor and get yourself tested. Do not live in a state of denial in this current pandemic. Anything you are having, it has to be COVID, unless and until you have ruled it out that this is not COVID.
So for the third wave, what are some of the patterns or things that people should keep in mind for the third wave?
There is, yeah.
What to do? There's so much of fear and there is so much. See how much ever we may say, and it is just the same. I think all you doctors, you know, it's so brilliant कि आप लोग बोलते हैं ना, सबके वर्ड सेम आते हैं. जैसे जो भी डॉक्टर्स हैं वो यही बोलते हैं कि फियर और डिनाइल में मत रहो. आपने भी आज यही दोनों वर्ड्स यूज किए कि डू नॉट स्टे इन फियर एंड डिनाइल. बट नाउ द थर्ड वेव इज कमिंग इन, सो पीपल आर नॉट सेंडिंग देयर चिल्ड्रन टू प्ले डाउन इन द कंपाउंड, कि दूसरे बच्चों को बुलाएंगे, थर्ड वेव में बच्चे अफेक्ट हो जाएंगे, तो हम उनको कंपाउंड में बाहर नहीं जाने देते, घर में रखते हैं. एज अ रिजल्ट नाउ चिल्ड्रन आर गेटिंग एग्रेसिव, एंग्री, व्हाटएवर. सो नाउ व्हाट वुड यू सजेस्ट टू पेरेंट्स, पर्टिकुलरली कि ये जो थर्ड वेव को बोला गया है कि बच्चे अफेक्ट होंगे, यंग चिल्ड्रन विल स्टार्ट गेटिंग अफेक्टेड?
See, first and foremost, this is a hypothesis. What we feel is something like this could happen because by the time third wave will come, we expect that majority of the population above 18 will get vaccinated. So the virus will need to find a new host, and the new host can be kids because they are because they won't be vaccinated, because all over the world the trials are going on, but none of the countries have started vaccinating their population below 18 years at this point of time, right? I think so. Even I think so. Only Germany is the one who has started vaccinating above 16 years old, but
Yes.
but 10 to 18 nobody has started. See, it is by and large largely believed that the kids under 10 years will, even if they get infected, it will be mild infection, and they shouldn't face any severe problems like hospitalizations or death, right? So the next vulnerable group is 10 to 18 population, for which a lot of parents are anxious about. But as I told, that if everybody follows a COVID appropriate behavior, if the parents follow COVID appropriate behavior, then the kids may not face the third wave.
Right.
It is very important. Secondly, as I said, do not live in denial. If
Yeah.
anybody in the family, or even if the kid is having any symptoms regarding regarding COVID, please consult your doctor and do take appropriate medicine. Okay, do not say that कि ये तो एलर्जी है, ये वेदर चेंज से हुआ है, ये चीज ये खाने से हुआ है, आइसक्रीम खाया था इसने, चॉकलेट खाया था इसने. नहीं, at this point of time we have to rule out COVID first.
राइट. तो ये जो एक्सक्यूजिज्म है और ये जो डिनाइल है उसको पहले निकालना है, सबसे इम्पोर्टेंट ये है. That and
Absolutely.
vaccine first is masking. If we have to give the priority, first is masking, maintain the COVID rules, then is get yourself vaccinated, and third is the denial and the fear.
Absolutely.
Except this, any other particular advice that you would like to add on, particularly with the ages below 10, and then maybe ages 10 to 18, children who are traveling overseas, who will be going to different countries to travel to study, and they are going to be traveling?
See, by and large, what one can do is certain things which can increase their own immunity, personal immunity, right? So that includes proper sleep. Sleeping is very, very important. So sleep on time, get up on time, keep a pattern, okay? Because a lot of people, a lot of kids are at home and they don't have schools or colleges, or probably they have online lectures and
Yes.
lectures and all. So their schedule is haywire. It is completely erratic. So do
Yeah.
not that impacts your immunity.
Yeah.
Eat healthy food. Good nutrition food is required. Exercise regularly. That is very, very important. Have proper ventilation in the room, because I've seen a lot of kids who are like closed, confined to their room throughout the day, not opening windows, and the same air keeps on circulating. It is not good for your health. So just follow these basic rules, which will increase your immunity, which will increase your basic resistance to the disease, so that even if you contact the infection, it will not cause any harm to you. It will not cause a very severe infection.
Right. So I'm sure all the parents who are in the audience today and listening to Dr. Kunal's free advice, let me also tell you that Dr. Kunal has very graciously given us all this time. And this is a complete, for all the parents across the world, you should take this advice on a very serious note and share it with your children to follow a particular routine, to follow a particular protocol in their life, which will avoid uh, the vulnerability. Because like Dr. Kunal just mentioned, that the virus is not now going to find a new host, and to cut down on that vulnerability, I think the children should take in all these measures. So I think I have exhausted all my questions, because you have given such clarification and such simply explained it. Because वही हो जाता है कि theoretical and technical terms you guys talk all the time and you understand, but as a layman, as a normal mother, as a housemaker, um, as a person from any of the developing, developed, underdeveloping countries, other members who are seeing, or maybe technical terms we don't, people may not be aware about it. And you have used such simple language and explained all of these things. So anything else that you would like to tell our viewers, except the great advice and the advice that you have already shared? Anything else that I must have missed from my side?
Well, at this point of time, this is most important advice that follow. See, uh, opening up of the cities or of the economy is a must for everyone.
Right.
It's,
Yes.
it's not only for the government, it is for us as well. So that thing will happen. But if we do not, mind you, we are opening up from tomorrow, but the positivity rate is still higher. Okay, we are still at 6.5, 7, I guess. Okay, ideally it has to be less than 5. So we are opening up, but we have to take care. I have already started noticing a lot of people on the road not masking themselves. Forget about double masking. They are not even wearing a single mask. So we shouldn't be careless about it. We should learn from the mistakes, what we did in the first wave. So follow COVID appropriate behavior. Do not venture out of the house unnecessarily, and take care. Eat good food, sleep on time, do regular exercises, keep a digital time of not more than 2 hours a day, and spend some time with your family and friends on phone, and have a good life. Take care, everyone.
Okay, thank you, sir. That has been such a nice, comprehensive, package of advice. I'm sure. So, friends, all the viewers who have been watching Dr. Kunal's conversation with me on the group of Association of International Educators, Dr. Kunal has given a very simple formula. Now it is up to each one of us how we use the formula, to what degree we use the formula, because as doctors they cannot come to each house, but yes, they are available on call, on WhatsApp, to give the advice, and to and be rest assured that all the doctors you are consulting are doing their fantastic job of protecting you first, protecting each of their patients first than anything else. So at this point, I would like to say thank you. I salute all the doctors and the warriors who have been working diligently. I know Mahavir Medical Research Center, the nurses, the doctor staff, which we are closely associated with, are working for more than 18 hours now. So I think that is the state of affairs in most of the hospitals and in most of the doctor families. And you could take out this almost 1 hour for us. So I thank you humbly, and I look forward to having you more on our program in this conversation. Friends, I request each one of you, the economy must open up. There is a large section of people in a country like India who are not able to feed their family 2 times a day in a satisfactory amount. And our Parigreh Foundation, Association of International Educators, are doing a lot of drives and doing a lot of programs for such people. If there are any interested donors, volunteers, advisors who would like to come forward and also join this program in having a communication on our program, I invite you to come ahead and participate actively on the story of the frontline warriors, the food donation drive, and various other drives which are being carried out by a Parigreh Foundation. You will be informed about all the programs on the pages and the groups of Association of International Educators and a Parigreh Foundation. So Dr. Kunal Shah, thank you so much for being on our today's meet. And I'm sure the advice, at least to some extent, it's like a reinforcement. बार बार बोलना पड़ता है rote learning की तरह. जब हम बार बार बोलते हैं तो कहीं ना कहीं it starts registering to the person. It starts registering. So, and also friends, if there is any patients or as the viewers, you would like to have appointment set with Dr. Kunal, you are more than open, welcome to write on our group, and we will be, Dr. Kunal will be very happy to advise you rightly into what should be done. So stay safe. And Dr. Kunal, before we go, there is a very simple poem that I have written, which I narrate at the end of each of our episode of the Story of the Frontline Warrior series. And I simply say, I am safe, happy, and healthy. My family is safe, happy, and healthy. My community is safe, happy, and healthy. My state is safe, happy, and healthy. My nation is safe, happy, and healthy. And my earth is safe, happy, and healthy. So, friends, let's all talk and pray for the healing of the earth. And I really, in this last 10 days, 15 days, many of the families or people have lost their dear ones. Again, it is not the lost. It is just a transition. The soul is transiting to another body. But yes, the grief, Dr. Kunal used the word that the grief overpowers the logical reasoning. So if that is the case, it is just giving you one word: courage and faith. So if you hold on to these two words, courage and faith, I think we will all be able to make a healthy, happy, and safe earth very soon. So thank you, friends. Stay happy, stay safe. Thank you, Dr. Kunal. Goodbye.
Thank you.